Hello, a very good afternoon to everyone. I welcome you to today's webinar on securing IoMT and the future of healthcare security. As the healthcare sector rapidly adopts connected medical devices, that is IoMT, to improve patient care, we are witnessing an unprecedented transformation in how healthcare is delivered. From remote monitoring devices to smart infusion pumps, IoMT is enhancing efficiency and patient outcomes like never before. However, this progress comes with significant cybersecurity risk. The growing number of ransomware attacks, data breaches, and unpatched vulnerabilities in medical devices poses serious threats to patient safety and data privacy. A single security lapse could compromise critical healthcare operations, disrupt hospital networks, or even put lives at risk. To build a secure and resilient healthcare ecosystem, we must address these challenges with advanced security frameworks. AI driven threat detection, regulatory compliance, and industry academy collaboration can help us achieve this. Today, our expert panelists will explore these key issues, discussing cutting edge solutions, and share insights into the future of IoT security. Our panelists include Dr. Jaspal Singh, who is the Associate Director, CDAC. We have Dr. Ferdous Ahmed Barbhuiya, who is the professor from IIIT Guwahati, and Dr. Rakesh Matam, he is the Associate Professor from the IIIT Guwahati. So to begin with, I would like to ask Dr. Jaspal that can you throw some light, sir, on healthcare security? That what exactly is healthcare security and how is it linked to IoMT security, sir?
Yeah, right. Right. Thank you, Niharika ma'am, and good afternoon. Welcome, everybody. Uh, healthcare security. Healthcare is one of the most important aspect of human life, and today, with the healthcare becoming more and more digital, we are talking increasingly more about the healthcare security. Now, before we get into the details of the technicalities, let us quickly understand what is healthcare security. That's the question to me, and I'll just quickly answer. And I'll put the whole thing in perspective, saying that uh, IOMT, healthcare, and security, these are the aspects which we will quickly introduce and then get into the technicalities. So when we talk about healthcare and healthcare security, we are primarily referring to one security, which, as we all understand, is cybersecurity. But there's something a little bit more than what cybersecurity is. And then there is an important concept of privacy, which is very, very relevant in healthcare. So when we talk about security, we are talking not only about the network security or the administrative security, access control, and the standard things that we talk in cybersecurity, but we are also talking about the physical security because the devices are directly or indirectly touching our body, or maybe even we have a wearables which we are wearing, and our own health actually depends on them directly or indirectly. So this physical security becomes an important aspect in healthcare security as an additional concept. Then privacy, we all know that data is required to be kept safe from being used by some unauthorized people. So we are talking about patient consent, confidentiality of the data, data protection, transparency in the patient's rights to data and its upgradation. So there are several things that has happened recently in India also, which we will talk about in later today. So I will also like Dr. Rakesh to throw some light on IOMT before we get into more details. Sir, what do you say? IOMT?
Thank you, Jaspal sir. Let me actually try to answer this question by first introducing the two terminology that we have. IOMT is actually kind of subset of IoT. So we have been listening to this Internet of Things, and lot of consumer products and industrial products are coming up very fast. And IOMT actually is a kind of another vertical in IoT. So IOMT basically stands for Internet of Medical Things. And when we have to distinguish between these two, the major difference is that IoT products typically have very small shelf life. So, for example, if you have a security camera, today you buy a security camera, and within 3 4 years you will have newer models, so you will upgrade. But when you come to medical devices, these devices have very long shelf life. So typically an MRI machine that is kind of classified as an IOMT device, it usually runs for decades, if not for decades, at least a decade, because these devices are very very costly. And also there are categories of devices. For example, you have like something like an MRI or a CT scanner, and we also have like implantable devices that also can be categorized as a IoT device or
Yeah,
IOMT device.
correct.
So when we are dealing with these devices, the kind of attack surface means means the range of attacks that are possible on these devices are very huge. So, for example, let me just take one example from the industry. Like there is an company, American company. It's called St. Jude's Medical. So they produce pacemakers. So these pacemakers in 2019 were found to be faulty. Means basically these devices can allow unauthorized access to the devices as you have specified. So this is one example where their models, they had three models basically: Assurity, Endurity, and Accent MRI. These three pacemaker models were basically recalled in 2019 because they were allowing unauthorized access.
Yeah,
Similarly,
yeah.
Similarly, there are multiple other types of documented attacks on these medical devices that makes it very critical in uh, today's time, basically, right? So, so with modern technologies, uh, these can be properly addressed, and I think Dr. Firdos might be able to elaborate more on what basically is happening in terms of industry and how it is evolving.
Yeah.
Sure, Dr. Rakesh, thank you. So, healthcare, as you mentioned already, it's a very evolving field. We are seeing more and more medical devices, what we call things, are getting connected over the internet, and that is going to happen more and more. So, the things which were earlier part of operational technology now suddenly came to information technology area, and these are managed by typically by healthcare professional, not necessarily by the IT department of an organization. And that itself brings challenges because the people involved are not security professional per se. Having said that, all these devices, they generate data, and these data, they not only generate, but these data flows to multiple systems, and even this data is shared over the internet for better consultation with other doctors, other medical service providers, hospitals, etc. Now that makes the whole landscape very very complex. At the same time, we have several regulatory compliances across the world. For example, HIPAA, PHI, GDPR, all that regulatory compliances, makes even things, more complicated. One hand, we need to ensure that we comply to the regulatory matters. Second thing, the data has to be secured. There has been several incidents of data breach specifically into the healthcare sector. There are adversaries on the one hand, that is outside the organization, and at the same time there may be internal threat as well. Considering these evolving threats, first and
Yeah.
foremost is a plan needs to be taken for every organization, every healthcare provider or organization which are related to healthcare, who stores or transmits healthcare data, is to identify the risks associated. A proper risk matrix needs to be created, and that's a industry practice elsewhere, where it's a basic security practices. But when it comes to healthcare, as the field itself is not directly related to information security or IT, so it creates challenges over there.
Yeah,
I
very
think
right,
I'll
sir.
pass
Yeah,
it
please
to
continue.
Jaspal. Yeah.
Please continue.
Right. So,
Okay.
considering these challenges, there are several measures that industry needs to take. We need to do whatever we are
Sir,
doing for IT
sir,
security.
Dr. Firdaus, just hold it there.
Yes,
I'll just
sure.
quickly summarize what we have said so far. One thing that you pointed out was that the kind of people that who are using these devices is there's a big range of them, right? So I'll just add
Correct.
one or two more there.
Sure.
One is the healthcare people. They are in the facility management, which are nurses and doctors kind of people. Then we have implantables and wearables also becoming a part of the IoT, IoMT, in fact, uh, where the operators or the users are not just the healthcare providers, they are simple patients, which means that maybe even less educated than the healthcare providers. So there are four categories which I could quickly
Correct.
summarize. One is the wearable devices and the implantable. Wearable and implantable is one set of devices that go into IoMT. The another set is the remote monitoring devices where telemedicine kind of thing is coming into picture. And the third is the hospital equipment like MRI and CT scan, which Dr. Rakesh was mentioning. So there are several range of people, and therefore the kind of security risks involved are also different, and their mitigation strategies differ. That is the point number one. Second thing that you mentioned about was the regulations that are now coming into picture. So we'll talk about the regulations shortly. And third thing that you talked about is the plan and risk mitigation things and that thing. So one by one, let us take up people using them. We have already discussed a little bit about that. So what next would you like to add into this discussion ahead?
Sure. Yeah. Thank you, Dr. Jaspal, for nicely putting it together. And I would add another category, that there is an involvement of vendor, which is a purely non-participating entity in the healthcare provider. And there is all these devices, data, software. There is a vendor, and it may not be always trustable. So, or it can be at least a curious entity. Now coming to what should be done. So the typical IT security practices, like strengthening cybersecurity measures or ensuring strong access control, that obviously we need to do. But along with that, there are other measures that is to be taken, both at the provider side and, as you mentioned, about the patient side or the common people side. Now, on the provider side, if we look at securing medical and device IoT, so appropriate measures like network segmentation, regular security audit, risk metrics, all that needs to be devised, so that we remain in control of those devices which are not which should not get compromised. And then next comes possibly establishing data governance and compliance, which we can go over later. But as rightly mentioned, that there is clearly another segment, which are the common people like us, who are using wearables, implanted devices. And if those gets compromised, there can be life at risk. So considering that, educating and training healthcare staff along with people, those who are using such devices, is very, very important.
Dr. Rakesh ji, what is your take on this regulations would you like to say something about that?
Yeah, well, not exactly. Means before we go to regulations, I would like to emphasize the starting point of all these vulnerabilities or all these attacks. See,
Sure.
if you look at it from security perspective, the attacks basically can be of three types, three categories. One is uh, somebody gaining access to this device, unauthorized access. This is one of the major category, followed by exploiting some kind of vulnerability in the device. What does that mean is that, for example, the device is using an operating system which is not updated. It's a small operation, small step, but not has not been implemented. So it will lead to security attacks. And the third category is more like active thing where attackers are actively seeking for manipulating these devices. For example, like the insulin pumps manufactured by Medtronic, right? They were using the RF protocol, the radio frequency protocol, which was proprietary. Basically, that's what Dr. Firdaus has mentioned. Vendors involvement. So they have used the RF protocol. So the attack was not very sophisticated. It was very simple. The people who were close to the insulin pump, they could actually access the insulin pump, and they could manipulate the flow of insulin. So
Oh,
this was so this was a simple attack, and Medtronic basically had to recall more than 13 categories of such devices. So this is a third nature of attack that basically needs to be addressed. And the fourth and final category is lack of standardization or of security protocols.
yeah.
So as adding to the point of Dr. Firdaus, so here the role of vendors comes into picture, or the role of regulations comes into picture, where government has to come up with some kind of standardization attempts or some and then, like, I think there are already some right direction with DPDP Act, and that addresses privacy concerns. But this is a point from which we have to take forward about the standards and the existing mechanisms like HIPAA or other guidelines.
Right. So, as what you said, I'll say put it this way: like one, the cybersecurity risk that are attached to almost every kind of device, computer using the internet. Those are the regular set of things like your uh, primary things like phishing, denial of service, and that kind of attacks. But apart from those cybersecurity attacks, which is standard, uh, we are also talking about the device vulnerability and its direct impact on the patient or the user. So that is an important set of categories. Now, then comes to takes me to the point that we need to have strong regulations about those things, and we need to understand the best practices being followed in various places and how to adopt them in IoMT related scenario. So, to my understanding, the best practices involve one, strong authentication is some of the is one of the most important thing that is very pertinent to what we are talking now. And second important category, which I will say, is the encryption of the data that is being transmitted using IoT or IoMT to be specific in our case. So these are the two things which need to be focused apart from what the standard network security and awareness and risk management and all the things. So these are the two things. And how do you think we can ensure authentication and encryption in cases of IoMT? Your takes, sir. Authentication and
Yeah.
encryption.
So once if when we are talking about authentication, we have to first basically consider the capabilities of these devices. What is the device? So when we are considering that it's an implanted sensor, then the kind of solution would be different compared to when we are protecting a CT scanner or MRI scanner. For
True.
why the it is basically because of the device's capability. For example, when you talk about protecting these, let us take an example of MRI scanner. It will run it is like a typical computer which runs a standard operating system. But when you consider a device like a smartwatch, which is having multiple connectivity options like Bluetooth, so protecting these type of devices or designing authentication mechanisms for these devices will be different. A typical
Very
computer
true.
can be, yeah, please.
Yeah, very true. The range of medical devices is huge. So therefore, the kind of authentication required is also variable. Now, as you just said, I was just thinking whether we can put in some kind of biometric things there. There are obviously we all know that fingerprint scanner, retina scanner are there. So how we can possibly include those things in our IoMT network to ensure to authenticate and authorize various functions. Yeah, is it possible?
Yes, yes, absolutely. However, one solution does not fit all possible scenarios. That is the key point here. Because sometimes these biometric solutions might be applicable in a hospital environment where Dr. Ferdous spoke about network segmentation. So we can actually protect these devices by keeping them access controlled and providing access only through biometric tokens. However, sometimes some of these devices are beyond this traditional boundaries of security. So, for example, somebody who is at home and he is being continuously monitored for using his continuous glucose monitoring system. There these type of solutions might not work, so you need more standard solutions like using other cryptographic tools
But
and
in those
techniques.
cases also, sir, in those cases also, like the patient monitoring being monitored at home, or maybe even the insulin pump that you just now told about, even in those cases, we can put some kind of authentication where for regulatory, I mean to say, for the authoritative work, like for if you have to change the protocols, if you have to change the way the particular device or the medicine is to be given to the insulin pump as to deliver. So in those settings, what we normally say settings of the device,
Mhm.
there we can put some kind of authentication to ensure that before it is connected to the internet or before the Bluetooth is activated, these things has to happen. Even in case of Bluetooth, we are talking about the two-factor authentication, and most of these implantable devices are using Bluetooth or any other RF based controllers. So they become vulnerable to the extent that anybody who is knowing that can easily access that particular protocols. But there also, do we have some areas where authentication or maybe encryption can be used? This should be reflected in some way where electronics plays a role there. The chip or the microcontroller, which is executing those codes, can somehow be improvised to have that. So this any further your thoughts on these or similar lines on about encryption and how it is evolving in cases of medical devices and even otherwise in the cybersecurity, encryption is a big area where even post quantum things we are today all talking about. And so, what do you say about these things?
Yeah, I would just add a point and pass it on to Dr. Firdos. Uh, what you said is absolutely true, but there are some unique scenarios where the solution might not be applicable. For example, if I have to protect a device which is passive, so there is no human involvement, I can, if it allows, I can use stronger authentication mechanisms like providing it with a
Maybe biometric.
NFT or even a strong certificate would help. But these solutions are not feasible in all types of devices. Some definitely true, but beyond some, there are some unique scenarios where these solutions might not be applicable. So, Firdaus, doctor, can you add a bit more on this?
Yeah. Yeah. Thank you, Dr. Rakesh. Let me take it from here. If we look at different types of devices, cryptography is a wonderful thing and it provides very nice solutions. But at the end, it's a costly, in terms of IT operations, or I would say in terms of computational task, it is a costly task. Most of the wearable devices, they rely on battery power, and doing such computation or a high cryptographic task drains out a good amount of battery. Now many of these IoT devices are designed to work in all situations, and they are not initially designed for security. So the security became an afterthought. First was functionality. Now adding security layer later on became very, very difficult. Now, this is one perspective. Second thing, now that we can see clearly two different types of devices. One is, of course, wearable and what patient use by themselves, and we can still do something. But there are devices which the provider uses, and they are managed by a different group of people, and which where multiple people, you and me, everybody go, and we share a single MRI machine. When my data is in the machine or the device attached to that machine, and my data flows, and what how do we know that the machine which is examining me, whether it is secure or not, and if it gives some wrong data that might be life threatening to some individual. So that is another way of looking at it, that how do we ensure that the device's integrity is protected, not only authentication, but how do we know that the firmware integrity is protected. Now, I will go into a different dimension. Typically, all IoT devices, including IoMT, always comes with an application software, and these application softwares, you know, that that by design, again, they are for a specific purpose, and the professional who are involved in designing that, they are not necessarily always core IT professional, or they are not core security professional. And many a times those devices were designed not in a secure by design mechanism, and
Right.
again, we try to put some measure into it and make it secure. Thereby, it is very difficult to say that whether those devices are fully secure or not. And there comes a strong regulatory measure, as Dr. Jaspal, you were mentioning, that we need a countrywide standardization and a regulatory mechanism, so that any device that comes to the market, it has to conform to certain roles. And there I believe organization like DSCI, NASCOM, 13 can play a very pivotal role, and we can suggest our government that these are the policies that we can implement. Over to you, Dr. Jaspal.
Excellent. Sir, since regulatory aspect has been brought forward, I'll quickly tell for the benefit of all the viewers here, there are strong regulations already prevailing in countries like USA and some of the European countries. In India, recently a lot of developments have happened. One of the most noteworthy thing is the National Digital Health Mission, which says that almost everything has to be digitized. The healthcare provisions have to be digitized, and is also very well known as You might have heard about ABHA, which is about Ayushman Bharat health records. So, ABHA records and NDHM has been activated in 2020 during the COVID times, which says that everything has to be digitized, and there are regulations in place, although they are not very strong, they are not as stringent as they should be, but they are in place, saying that security and privacy and all the related aspects and the patient consent, to be very specific there, are all required before we get into all these digital health issues. Similarly, one more bill was there, which is about 2020. We got the this thing telemedicine practice guidelines were circulated by Medical Council of India, and happy to add that CDAC has been providing telemedicine across India for since that COVID times, and is probably world's largest telemedicine provider today. So the telemedicine guidelines were in place, and then two more things have happened which are very pertinent to tell. One is the medical device regulations, where 2017 Government of India circulated a draft bill about the medical devices to be regulated by a authority, something similar to FDA authority, FD of USA, that is in place, although the exact rules for each of the devices are not that stringent, but it roughly puts up everything into four different categories, A, B, C, D, based on their risk profile. They puts it into the categories, and the devices are regulated and certified by the authority before they can be marketed in India. So that's in place, although not that stringent, we have to admit that. But anyway, that is there. And one more thing, finally, very recently that has happened is a DPDP, a data protection bill, personal data protection bill, that is about data protection of every individual of India, and ensures that we need to be having suitable measures to ensure the privacy, and gives everybody, every citizen, a right to understand where the data is being used, how it is being used, and how whether he can refuse to share that data. So that kind of things are already in place, and a lot of things are happening, but the things need to be evolving, and we will be seeing more of it now soon. So this is there, and any more additions in this, or you can even talk about the mitigation plans that we should not miss before. That's also very important, so we shouldn't miss that. Your comment on any of these topics?
Yeah, yes, as rightly pointed out, the one of the major role of these different guidelines is that they address the privacy aspect of user data, right? So this is where, and this is also correlated to the other technologies that work in tandem when you are talking about IoMT. So when you're talking about IoT or IoMT, you have technologies like cloud computing, technologies like artificial intelligence. All these things comes into picture because when we are developing any kind of mitigative solution or even application solution, they have to work together. So, for example, if you take a hospital setup where you are having huge number of IoMT devices, all these devices generate huge amounts of data. When they are generating these data, this data can be leveraged to design any kind of mitigation mechanisms, prediction, analytics, vulnerability detection, predictive analytics, automated threat response. All these are part of solutions to address the problems that are raised or that arise out of these IoMT devices. So, for example, we can talk about use of federated learning in design of solutions that will mainly address the privacy aspect, which is the core component of all these guidelines and regulations. Uh, Federated learning basically ensures that your privacy is preserved, but still the objective is achieved. So,
Dr.
I think
Firdaus,
Dr.
without
Firdaus
talking
might be the
about
right person to talk more about this federated learning because he has been working in this for quite some time now.
okay, okay.
Dr. Firdaus, would you like to add on federated learning and how it basically enables
Sure.
privacy?
Thank you, Dr. Rakesh. And I will again, once again, before I jump into federated learning, I will take some cue from the two, big security incidents that has happened in our healthcare sector recently. One of them, all of us know that 2022, the attack in the AIMS servers in New Delhi, and the second was like again September 2024. It was the Star Health, which is kind of India's one of the biggest health insurer, which suffered data breach, and the stolen data amounted to 7.24 terabytes, and about 31 million customers were affected by that. Now, having said all that, if we look at the root causes, some of the, of course, some of the, I don't want to go into the analysis of it, but as Dr. Rakesh rightly mentioned, that we can avoid all this situation by leveraging technology, and one of the technology is federated learning. Now, we all want to know the data, analyze the data, but at the same time, sharing the data is risky over the network. The adversary can always find the data when we transfer to someone else. And again comes the regulatory issues. Let's say if we are talking about US healthcare data, we cannot access it even in India or elsewhere, because of regulatory issues. Now there comes in rescue is new, or rather relatively new paradigms of federated learning, where we do not share the data per se, but what we do is instead of sharing the data, we actually ship a model to our intended participant. Let's say a hospital, they do not send the data to another hospital or another organization or regulators, but they execute the model in their premise on their data, and the model learns from their data the insight, and that insight can be transmitted. Now if somebody gets the insight in the middle, he cannot make out that this is related to what, and no data can be attributed to any particular patient or an entity. So thereby the purpose is served, but at the same time the data is not shared in traditional means. So some of those technologies, if leveraged, can solve many of our problems very, very quickly.
Excellent. So that gives a outline how we should be future-proofing our IoMT systems from the cyber security risks. Any more comments before we close this session, or maybe we ask Niharika to take over? So, any risk matrix you were speaking? Any quick comment about that matrix and how that matrix can be related to AI or federated learning or
Yes,
that?
yes,
I I
right.
guess,
So I
yeah,
was
we
talking
can
about risk
plan.
matrix.
Yeah, please,
Right.
please.
So, although the word looks very geeky, but and it seems that it involves a lot of security professional, but it is not that. Every organization, if they analyze that what can go wrong with their devices, who are the users, what all protocols or what all applications that are running, and if they analyze it properly, and they can simply tabulate that these are the risks we are having, and then they can
Okay.
have a strategy against it if something goes wrong. For example, if we again look at the case of AIMS in 2022, the fallback mechanism was that they had to switch to manual mechanism. That's
All
not
right.
desirable in a country of 1.5 billion plus population, We need to keep our medical system up and alive and kicking in case of all emergency situations, so that our
So
adversary cannot take an advantage of it.
great. I'll put it this way, slightly this way. Risk plan for risk management of each of the devices varies and is dependent on the kind of device, kind of the user, kind of system that is being used there. And a federated learning is a concept where we are able to use the data from the different locations. It's a sort of distributed kind of thing, and is most apt thing, most correct thing, most suitable thing for IoMT environment, and therefore the two things gel excellently and can be excellent way of going ahead in IoMT security issues, right? Yeah, that's it. Niharika, would you like to take
Yes, sir.
over?
Thank you so much, sir. So, as we are here collaborating for the academia and the industry perspective on IoT security, I have like few questions for you. So, to begin with, Dr. Rakesh, sir, how do you think that the current cybersecurity education is adequately preparing students for securing IoMT? So, what improvements are needed in the Indian academic institutions to prepare the students
Thank you. We have been making quite a lot of drastic changes to our education system with the NEP coming into place, and more and more higher education institutions are starting specific programs that are addressing cyber security as a major specialization. So there is an increasing awareness among the population, and the programs are also now being designed with the industry perspectives in mind. So we are making progress. However, more collaborations with the industry are needed, especially the major buzz that is around AI right now is plagued, or mainly the limitation is about the data. And if you talk about a sensitive field like medical technology, here the data is much more scarce. So there has to be, and if we have to adopt technology and design solutions, more and more organizations need to work on different types of technologies to make sure that we develop solutions. Like for example, in the US, we have NVIDIA and Mayo Clinic coming up with a solution to detect cancer using federated learning, where these two organizations need not share data, but still can be the objective can be achieved. So something like that in terms of collaboration, especially like organizations like CDAC, Mohali, which they are dealing with telemedicine. So as part of it, they might be collecting huge amounts of data, which may not be readily available for academic institutions. There has to be some kind of bridge which can provide us with access, so that academia can leverage this.
True. Dr. Rakesh, you have very rightly pointed out a very pertinent thing that is a huge requirement of India. We, as the Government of India organization, always welcome to collaborate with various academic institutes for research. In fact, we are running very shortly. We are going to make a mega project, and a call for that would be out there for AI-based not only diagnostics but also person specific, which we are now calling as personalized medicine and precision medicine, right? So
Right.
precision medicine is another topic where a lot of learning and AI systems come into picture, digital twins come into picture. So these kind of things we are actively working on and looking forward to the academia to support us in various initiatives that Government of India is doing, and we are also part of several of them. And we look forward to that kind of collaborations to take maximum advantage. Yeah.
Just to add,
Sure.
we have a MOU with CDAC Mohali, just
Oh,
as
great.
a
Okay.
in cyber security,
Okay.
with
Okay.
the
Yeah.
cyber
Yeah.
security.
Cybersecurity. Okay. Okay. Was that during Rakesh Saigalji time?
Yes,
Um,
true.
Okay.
yes, it was signed,
Okay.
I think, in 2019.
Okay. The Saigalji left, but anyway, we are here. We we are here to take it over.
Yeah, so in that way, CDAC Mohali has always been collaborating with academic institutions.
Oh, great. Yeah.
Right. But I take a cue from there that, yes, CTech Mohali and we are collaborating, but we need to get on board more and more hospitals' clinical data the way,
True.
we available for other, countries, typically developed countries. We are still, we are yet to make progress at that level. So collaboration with medical practitioners are of
Yeah,
great
we have
importance.
we have a good set of tie-ups with hospitals also around this Chandigarh and the around area. Also, I would like to add that since our team has been working in medical for more than 25 years, so we have a very good understanding of the medical concepts, the anatomy, the physiology, and how the hospitals and the doctors and the whole medical system works. We have been into this for more than 25 years, and probably we are the first, the pioneers to start a course called biomedical engineering when the colleges in South started copying it, and then we stopped it. They started copying, and we stopped them. So we have a very good history in biomedical engineering and biomedical technology, biomedical electronics, and all the related concepts. We look forward to that. So yeah.
Thank you so much for
Wonderful.
sharing this, sir. One question for you, Dr. Firdaus, that what do you think that how the policy changes or the incentives would encourage stronger security practices in healthcare sector? That what policy changes should be there?
Very pertinent question. Although the range is very large, but I will keep it short in the interest of time. First thing is that when a new device or a new application comes into market, it has to pass through a regulatory process. That whether it is really fit for market, whether it passes all the security parameters or not, and again, these are specific to devices, and we have again CDEC is also involved there. There are steering committees which are setting up standards, and there's also a member of a couple of committees in other fields. But I think we need such steering committees which will set standard for, like, if it is an MRI device, what it should be, or if it is an X-ray machine, what it should be, or even it is a glucometer, what kind of regulatory measure it has to pass. This is one aspect. Second aspect is, of course, the data protection, that who can store data, with whom it can be shared. Right now, although Disha is there, but it is still in the nascent stage, and it doesn't talk about rightful sharing, who all can be stakeholders in case of data sharing, and how the data and where not to share. So those clear directions needs to evolve, and that evolves over a period of time. Of course, we cannot expect everything to happen in a matter of weeks or months, but I'm sure this will evolve. But these are the two aspects I think is the foremost importance. And of course, the third aspect is there is to how to penalize, and that the legal system in our country is robust enough to think about that. But first two measures are of utmost importance, that what should be there.
Thank you so much, Dr. Firdaus. And before proceeding, I would like the audiences to know that they can post any queries or questions if they want to ask in the comment sections. And we have such experienced panelists with us. They'll take this chance and ask them questions. And also, we have published a paper on healthcare security in IoT environment, which you can find the link on our NCOA website. We'll be giving the link and we'll be posting the link in the comment section soon after this webinar is over. So, if we move to Dr. Jaspal, can you please throw some light that how can blockchain improve data security and device authentication in IoMT networks? So that what are the practical challenges if we are adopting these technologies?
Okay, practical challenges. Actually, when we talk of hospital scenario, IOMT is not only in the hospital, but it extends to a user in his home, to a remote location where ASHA worker is using it, or proper hospital where hundreds of such IoT devices are connected to the patient, or as a facility like in CT scanners which we talked, or maybe even saw simple things like syringe pump or various other such equipment. So four different categories of users we are talking, and therefore the four different kind of risk matrix formed there, and then there are n number of devices and number of specialities depending on the human body itself. Each of the body part has a specific set of doctors which are specialized in certain areas, and therefore the devices in that department are different from the devices in the other department. Devices in the ICU are completely different than devices say in the physiotherapy department. So in an ICU, it's something very, very different where critical things and a latency of a few, maybe let us say few minutes can be very, very critical. And there, a simple thing like a denial of service by external party, by external intruder can cause a lot of problems. So the risk in each of the categories is different, and their obviously their mitigation and their practical challenges are variety. There is a huge variety of the challenges there. Next, specifically talking about the practical challenge that a hospital say faces, is that the users are already too busy in handling the patients and providing the care, and therefore the simple things like two-factor authentication becomes a challenge in many of the settings, where why the doctor who is or the nurse who is monitoring the patient just lying a few feet away from the bed, from her chair, has to give a two-factor authentication whenever she has to do some, let us say, change the settings of the syringe pump. So those challenges are there, which are from practical point of view, which arise because of the difference in the level of awareness of the users, and difference in the type of machines that are connected there, and the kind of connectivity those devices or their risk associated is different. So therefore the practical challenges vary a lot, and obviously the first and the foremost thing would definitely be to make the people aware, and second is to make the people make the devices pass through a certain specific regulatory process. These are the two primary things that we discussed and should be in place to mitigate, to handle the practical aspects of the security issues. Yeah,
Very well structured, sir. Thank you so much. We have one question from the audience.
yeah.
It's like, is there any data set used in federated learning to secure IOMT model?
Maybe I'll take that question. So to answer the question, there are two, three data sets to my knowledge is available. For example, chest X-ray images. It's a ResNet 34 model. Although this part of information is a bit technical, but to answer it clearly, there is a chest X-ray images data set. Then there is a human activity recognition data set called HAR data set. It is also there. There is also a CICIDS 2017 dataset is also there. And of late, there is one more dataset that is published by a US university that is on depression screening dataset. Incidentally, the researcher who published that dataset is one of our alumni and our direct student. So I know at least three, four datasets which are available.
Thank you so much, sir.
Dr. Firdaus, I'll just, for the benefit of everybody, is there any difference between the data set being used for a general AI, standard CNN models or something like that, and those used for the federated learning?
Yes, very pertinent question. Of course, we can use the standard data set that are available, in federated settings as well. But the advantage of federated learning we won't get if we use a uniform data set. So federated learning basically calculates a difference, which we call as a delta between running the model at different settings. Now, again, I'm going a bit technical here, but to answer it properly, I would say that in federated environment, it's better to have diverse data set, not taken from only one hospital, or not taken for only one disease, or not taken from only one type of devices. So if we can mix and match, we can expect better result. Otherwise, in a machine learning stuff, what we call is overfitting that might apply.
Can we say non-homogeneous, or if you allow me to give an example, we collected a data for the sound from the chest of the babies, right? Babies from 6 months to 5-year-old babies, we collected a huge set of data about the chest
Hmm.
sounds, right? Using a
Hmm.
stethoscope. Now we used it in
Okay.
certain model. Then now
Right.
if we collect the same kind of data from
Hmm.
another set of patients using
Right.
another stethoscope, a different stethoscope, then does
Right.
this become a better way to put it?
Yes, the diversity, if we create in terms of devices, in terms
But,
of patient,
but
in terms of
sir,
geography,
I'll,
right?
I'll, I'll just like
Yeah.
to add one more thing.
Yeah.
Diversity of data, unbiased data, and
Right.
robust set of things is very
Right.
important for any kind of AI, whether it is federated
True.
or a standard simple CNN
True.
model or any other machine learning model, right? So
Not one.
that is an imperative, that is a requirement
Correct.
of a good working solution as an output, right?
True. True. Right. So here in this case, if we use the same data and let's say divide into 10 silos, there is not much of meaning because we are artificially creating a situation for federated learning. So what we typically expect is that there are independent organizations which are generating data independently, or at least independent applications which are generating data, and then we are trying to deduce conclusion out of it or do some learning about the data using federated environment, where we really do not share the data but share the insight about the data.
Right.
Thank you so much, sir. So we are just coming to the end of the session webinar. It was a very insightful session. We actually covered so many points in the section. So just last 2 minutes, if any audiences do have question, please post, and we'll be sharing the link of the report which we have published along with IIIT Guwahati, and the link will be shared in the website. So any last pointers, sir, if you want to say?
Uh, we can see one
Final
more
thoughts,
comment.
like one key takeaway for the audiences on securing IoMT devices and how academia and industry can work together.
Before that, Niharika, I can see one more comment, made by Mr. Sarath Chandra Babu. And he mentions that there are many stakeholders in health sector. Designing some awareness program would help as part of IACA program of METI addressing this segment. Of course, it is not a question, but we all agree, I guess, some kind of awareness program is necessary. And again, here also we need collaboration because, as a security professional, we do not understand maybe the healthcare sector pretty well. So we require collaboration between healthcare providers and healthcare technology partners like CDAC Mohali and, academic institute like ours. And for the concluding remark, maybe I would request Dr. Rakesh to put some concluding remark.
Yeah. Yeah, so this point I wanted to make when Dr. Jaspal was talking about collaboration. India AI is an initiative started by Government of India, which is not only relevant to medical, but all areas where AI can be applied. And one of the key areas that India AI is pushing is medical technologies. So they are trying to make sure that industry and academia, along with other arms of the government like hospitals, etc., they want to make sure that the models that are being developed are trained on Indian data and also applicable for Indian data. So I think one of the initiative or the policy that Niharika was mentioning, India AI actually is trying to address that. This would be my concluding remark.
Yeah,
Thank
definitely.
you so
India
much.
AI is there and call for proposals and is a regular feature there. We can
Right.
all join hands to get apply there. Yeah, definitely.
Right.
One last quick question. I think Dr. Ferdous can answer this. Can you please share the name of model where ResNet 32 dataset is implemented?
So that is chest X-ray images.
Thank you. Thank you so much. Thank you so much, everyone. Thank you, Dr. Jaspal. Thank you, Dr. Rakesh, and thank you, Dr. Ferdous. Uh,
Thank you, Niharika, for
Thank you.
hosting this session.
Thank you so
Thank
much,
you.
sir.
Thank you,
Thank you very
everybody.
much.
Thank you,
Thank
Thank you
you.
to you
Niharika.
Thank you,
all.
sir. Thank you. Thanks.
Wonderful.
It was
Wonderful.
nice. Yeah.
Thank you.
Thank